talked earlier about how we get a lot of molecular information about the biology of the tumour from the tissue that the surgeon removes. When you take a patient to the operating room and you remove the ovary, the fallopian tube, and the pathologist gives you some molecular information about that particular patient's tumour type to help determine whether these drugs may or may not respond. You've also talked today about how these tumours can get quite clever and develop mechanisms to fight off the chemotherapy and become less resistant to treatment. Is there ever a role for somebody like Michelle in going back to get more tissue if they have disease that remains? If you biopsy metastatic lesions, does that give you extra information to say, well, we're on this course, but we're veering off, let's re-biopsy and get up-to-date molecular biology about the tumour, or is that not necessary?
No, I think that's probably where the future is going to lead us. But do we need to biopsy the tumour, or can we somehow get this information from a blood test? So there's a lot of interest in cell-free DNA or tumor DNA that they can pick up from a blood test, where they isolate it down to the tumor DNA, which is fascinating, and it helps patients be able to avoid a biopsy and still gives you that critical information to help you make a treatment decision.
Diane, we're hearing so much about these new treatment options, and it's almost impossible for us at the coalface as the physician to keep up to date with going to conferences and learning about new treatments that are just FDA approved or pending FDA approval or new clinical trials. We're constantly having to keep up to date. It's overwhelming for us to communicate that information down to a patient to take back to their physician when the landscape is changing. How important is it to allow a patient to get to the right doctor for the right treatment? And how do you advise them to steer their physician into making sure that they are offered the best possible care?
So we have different ways through FORCE that we can help navigate people to make sure that they're getting to the right doctor or access to the right trials. And so overall, broadly, we have a team of about 300 volunteers who are trained. They graduate through our Volunteer Force Academy, and we keep them up to date with everything that's changing really weekly. They receive information from us. So on our website, we have a clinical trial database search tool where an individual can go to the website, they can put in their information, whether they're just a high-risk individual, they can put in their cancer type, their cancer stage, and that'll help search for clinical trials that they may be eligible for, and they can take that information with them to their doctor. We have volunteers who are available through our 24-hour hotline. We have a helpline where people can call in and ask questions. They can have someone navigate that clinical trial tool for them. They can attend one of our 50 support groups across the United States where a volunteer can help answer their questions. They can guide them to these clinical trials, to doctors, to the professionals where they need to go. And then we have an annual conference every year. It's the largest gathering of individuals and experts in this hereditary breast, ovarian, and related cancer field, where there's so many sessions, not only for the patient and healthcare provider, but also for caregivers. So they can be brought up to date with what's new and upcoming in this research, how they can help navigate their loved one through this maze of information and be there to support them. Because, as we've been talking through this whole segment, knowledge is power.
Right.
And if the caregiver also has this knowledge, as the patient and the loved one is going through their treatments and they're tired and they're sick and they can't think, the caregiver then is given this information, and they can get checklists on what they need to be asking the doctors, and they can help search for the right clinical trials and take all of this with them, and then they are armed with this knowledge too.
And I think that medicine's really changing in that years ago patients were very much directed for treatments based on what the doctor told them, and yet we're encouraging patients to be more and more proactive. The internet has made the world a much smaller place to get patients connected with the right physician for the right treatment. And I think it's important to emphasize to our audience who are watching segments like that like this, that if they do their own research through websites like yours, through organisations like yours, that actually there's huge value in taking information to their doctors and asking, am I eligible for this? Do you know about this? Have you read about this? And I see it in my own practice that sometimes when patients bring articles to you from the newspaper, or they've done their own research, it can actually really help guide the care and bring up topics of discussion. I also think for patients who may read something and think that they are eligible, it's often important that we in the medical profession explain to them, if they're not eligible, why they're not eligible, so that they think so that they know that we're not withholding treatment because we're not aware. And it may be that not everybody's eligible for every medication. Your thoughts on that?
Exactly, and that's why it's important, to do your homework. And, it gives not only the caregiver but also the patient, just that little bit of control, because if you're diagnosed with cancer or you find out that you carry this mutation, your world kind of goes out of control for a while. And being your own advocate really helps, helps you to understand and helps bring some of that back into your control. But yes, it is important. And one thing, and you mentioned this earlier, it's not a one-size-fits-all. What I chose to do for my own preventative service or measures is not something that someone else would choose to do, or they might not be able to do because of other health concerns. So it's really important to do your homework.